This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
Dr. Yasmin, our topic today is on uterine fibroids.
Uterine fibroids are non-cancerous tumors of the uterus.
Uterine fibroids are actually very common.
I told her that I don't want to do cesarean.
Pelvic pains, heavy menstrual bleeding, or trouble getting pregnant. These are a few of the symptoms that women with uterine fibroids may present with. I am Dr. Khawla, and we have dedicated this episode to learning more about uterine fibroids.
My name is Shahrazad Jassim. I was not feeling good since 1 month ago. It was my first check after 10 years ago. And I find that I have a fibroid, and this fibroid, it was bigger than 12 centimeter. Good morning, doctor.
Good morning, dear. How are you? Please take a seat.
Thank you so much. Thank you so much. My name is Shahrazad Jassim.
Hello.
And I'm coming just to check with you because I'm having some trouble and pain since 3 days ago.
Right.
And I would like to check what I have exactly.
Okay.
If you can give me your advice.
Thank you for coming to this hospital and choosing to see me. May I know what exactly is wrong? Are you having pain?
For the moment, I have a pain, and also I checked some doctors, and I don't believe that I have a fibroid because they said, and I have some scan also. And all the doctor, they advised me to do surgery.
Okay.
But I'm not looking to do the surgery because they said you need to do cesarean, and I don't want to do cesarean.
Okay.
And for this, I'm coming to see you because they advised me you are a professor and you are in charge of this fibroscopy.
Yes.
And I would like to check with you if I need really the surgery.
Right. Before we start, I just want to tell you something. We will check everything. I will ask you a few questions. We will do some checks maybe. And after we are through, if you do need a surgery, which you might not, do not be afraid of anything. This is a place which is very, very professional. We are here to take care of your fears.
Thank you.
As well as your health. So even if you do need a surgery, it's not really as scary as you might think it is.
Thank you so much.
Right now, I'll just ask you a few questions and take some notes, and then we'll go for an ultrasound to check whether you do have any fibroids.
Okay.
May I know how long you're having these problems?
Since only exactly 10 days ago.
Okay.
I was feeling that I have like Barber's hairs.
Okay.
And I was suddenly I start to have a pain.
Huh.
Exactly. I checked with the first doctor. He asked me for ultrasound also, and he find that I have five fibroid.
5?
Yeah, 5 fibroid, and it's showing like it's 12 centimeter, one, the big one it is 7 centimeter, and another one it's 5 centimeter.
I'm so sorry to hear. You must be really confused
scared,
and scared. So, are you having heavy periods and difficulty and a lot of pain during periods?
I have a lot of pain, yeah. Lot since like 7 years ago.
Since 7 years you are suffering?
Yeah.
Right. So, do you have any other problems? Any medical issues like diabetes, hypertension, any high blood pressure, any asthma, any breathing difficulties?
The only problem I have asthma. And it is not all the time I'm getting this case of asthma.
Do you have any allergies?
I think I have allergies from augmentin. Yes, yeah.
And do you have any surgeries before in the
Never.
past? Never. Are you having any children?
No, I'm not married.
Not married yet, right. So I hope that you are okay. I wish we had met earlier. You wouldn't have had to go through so much of pain and difficulty in the last 7 years. But we will check you and see what we can do about it.
Thank you, doctor. Thank you so much.
So let us go for an imaging now. We do an ultrasound. We will take you to another room and then we will use a probe. We will put some jelly on your tummy.
Okay.
And we will use a probe and just place it on your tummy and check a TV, a monitor like this. And I will explain to you what is inside. You can see for yourself what exactly inside, whether there are any fibroids inside or not, what is the size of the fibroids, and whether you would need to go in for any other extra tests or not. Hello, Shahrazad. How are you feeling now?
Little scared.
I'm so sorry. I'll try to make you as comfortable as possible. So first I'm just going to touch you a bit and try to feel whatever you are describing. If I can feel fine, if I don't, then I will check what's going on in the ultrasound. Oh, this does look like a fibroid. It is quite big. Let's see the ultrasound. Don't worry. The principle is, when the doctor is not scared, then you have no reason to be scared. This is your scanning. I can see some fibroids. I will show you exactly where is the location and what is the number. And then we will describe and discuss what we could do about this. There you are, Shahrazad. Can you see this?
Yeah, okay.
This is the uterus. You can see the shadow of the uterus here.
Yeah.
You can see the 2 ovaries which look normal. And you can see these tumors which look like fibroids. Let me check the size. Okay. This is about 13 centimeters. There's another one in front above the bladder. There you are. That's about 7 centimeters. And another one that's about 6 centimeters. So you have 3 large fibroids, and I wouldn't be surprised if you have some smaller ones. So this is a condition. However, your uterus looks good. None of these fibroids seem to be poking inside your uterus. So it is better that we do something about it. So let's go to our clinic and then we will discuss what are your treatment options. Prior to that, I would suggest that you do some special imaging like an MRI scan. And that will delineate, it will map the fibroids, it will show the exact location, the exact number, and with that information, if we could take all of them off, you will be back to normal very soon. The good news is that you don't need a cesarean.
She said that I need surgery, but I told her that I don't want to do cesarean. She said, don't worry, the same day of your surgery, I will let you know. But I will make sure to not to do it.
Hello, Dr. Yasmin.
Hello, Dr. Kaula.
How are you?
Good. How are you?
Good, good. Thanks for having us today.
My pleasure.
So, Dr. Yasmin, our topic today is on uterine fibroids. Can you tell us first, what is uterine fibroids?
Uterine fibroids are non-cancerous tumors of the uterus. They can be very small or they can be really very big. The largest I have seen till date is about 25 centimeters.
So that's pretty big, 25 centimeters.
Yes, right.
So I guess the big ones have more symptoms and that's why they present to the doctor, or do all have symptoms?
All fibroids do not have symptoms. In fact, most fibroids don't. Very small fibroids can have a lot of symptoms, and very large fibroids may not.
Very interesting. So size does not necessarily correlate with the degree or the extent of the symptoms?
Absolutely right.
Okay. And for those who have symptoms, what are the most common ones you usually see?
The commonest symptoms we face in relation to fibroids is heavy bleeding during periods, severe pain during periods. Sometimes you could get a lump in the tummy, or you could get back pain, pain in the legs, pressure symptoms like, for example, difficulty in passing urine, difficulty in passing stool with constipation, and pain while they're having a relations. These are the commonest symptoms one could face.
Very good. So if I have a patient who's coming in and I'm suspecting uterine fibroids, what is the test that I need to do to confirm them?
Usually we do a gynecological checkup, and in the checkup, which includes an ultrasound scan, most commonly an internal ultrasound scan, fibroids are usually visible.
Okay, so we don't need any imaging like CT or radiation exposure. Just with a simple office ultrasound, we can detect fibroids.
That's right.
Very good. So, Dr. Yasmin, I heard we have a patient who has uterine fibroids and is pretty symptomatic from them. Can you talk to us about her?
Yes, this is about a lady called Shahrazad. She's around 30 years old, unmarried lady, and she's having a lot of pain during periods. She came with complaints of severe pain, sometimes heavy periods, also a lot of urinary problems in relation to symptoms like frequency of urination, difficulty in passing urine, sometimes constipation, and a lot of back pain. She's an office executive, so life was pretty miserable for her, in the sense that whenever she would be working in the middle of it, she would have to rush to pass urine. She would have a sensation of incomplete bladder emptying, and so she came to see me after going through a lot actually. She's already seen a lot of doctors, and she knew that she had fibroids, but somewhere she was afraid that doctors would tell her to do a surgery and remove it, and that was getting her really petrified.
Yes. If I heard you correctly, Dr. Yasmin, 30 years old?
She's around 30, yes.
So fibroids is not, it's not a disorder of elderly women or advanced age. It can happen even at a young age of 20s and 30s?
Absolutely. It can start as early as 16 years of age, and usually there is a family history. Between 16 to 50 is your reproductive age, where you get a lot of estrogen hormone, which is the hormone of the female reproductive system, and that is the basic reason why you do have fibroids. Once you reach menopause, if the fibroids are small, they can actually shrink. So it is this age group which usually suffers from fibroids, and that some of them need treatment, many of them don't need treatment, some don't even know they have fibroids, and they spend the rest of their life and go into menopause comfortably.
So Dr. Yasmin, tell us what was sort of the conclusion from Shahrazad's visit? What is the next step?
After examining her, we found a lot of fibroids, 3 of them, and considering the size and the number of the fibroids and the problems that she's facing, and also the potential for future complications that she could face, I did suggest her to go for a removal. I assured her that it's not going to be as scary as she feels. She could come in one day and go home the next day. If she wanted to go home the same day, she's very much welcome to do so. Somewhere she felt convinced, and she's agreed to do this procedure. And although there's a lot of fear in her, I think which cannot be overcome without her going through the whole process and getting comfortable. Once she's through, I think we can have her happy enough at the end of the day.
Very nice. One of the fears I'm thinking of right now, for people who are listening, can I get pregnant after a procedure?
Absolutely, absolutely. In fact, fibroids do come in the way of pregnancies. A fibroid which she's carrying is 13 centimeters. She's around 30 years old. When she gets pregnant, to accommodate the baby as well as a large fibroid like this would be very, very challenging.
Fighting for space.
For the baby, yes, absolutely. So removing the fibroid would be a boon for her future fertility. Not only this, for many other women who are suffering from infertility issues, if we do remove fibroids, they can actually get pregnant. And people who are having a hard time, they can know what is wrong. So I feel everybody should be checked for these conditions, people who are having fertility issues, subfertility issues for a very long time.
Very good. I'll come and see you back, Dr. Yasmin, after her surgery and check on her as well.
Sure, Dr.
Thank you very
Kazi.
much.
Thank you.
Did you know that uterine fibroids are actually very common? Almost 80% of women will develop uterine fibroids at some point in their lifetime. Now, of those 80%, only a smaller percentage, about 25%, will develop symptoms related to their fibroids. Did you also know that uterine fibroids can grow bigger or can even shrink over time? Now, the good news is, regardless of what size these uterine fibroids are, their potential for turning into cancer is extremely low. Hello, Dr. Yasmin, how are you?
Hello, I'm fine. How
Good
are
to
you,
see you
Dr.
again.
Kaza? Same here, same
Thanks
here.
for having us again.
Thank you. How do you do?
Good, good, good. So, Dr. Yasmin, tell us what happened with the surgery.
Oh, it was wonderful. It was great. It was the best surgery possible for her. She's very, very happy.
Oh, that's great. And how many fibroids did you
I
were you
took
able-
out 5 fibroids.
Wow.
There was another one at the back of the uterus. So total we took out 5 fibroids.
5 fibroids. And in people who get fibroid surgery, do they go home the same day or?
Actually, many people do go home the same day, but some, they are sensitive, they want to sleep over in the night. When they're comfortable, they go mostly by the next day.
Very good. And this is usually the typical, or at least the most common post-operative course, right? That you see with people after fibroid removal. Things go smooth and they go home basically.
Usually, yes.
Very good, very good. So Dr. Yasmin, what other options do we have to treat uterine fibroids other than surgery?
Other than surgery, you could offer medical treatment mostly in the form of hormones. These hormones could be hormone injections or hormone tablets. We also have the hormone IUD, the Mirena. That also works in some fibroids which are small. And we also have hemostatics like, bleeding controllers and tablets for pain. That also can be used as an adjunct to symptoms related to fibroid. If the person is very close to menopause, we can consider these options so that we can bide the time so that they reach menopause and we can do away with surgery.
So what happens to the fibroids after menopause?
Most of the time, if the fibroids are small enough, they shrink. However, if they are very big, then they may not. So that has to be explained to the patients that you could try, but keep your options open.
Very good. Thanks, Dr. Yasmin. This was very informative.
Thank you so much,
Thanks for
Dr.
having
Kaula.
us.
Thank you.
I started looking with my friend for the best doctor in Bahrain. They recommend me Bahrain Specialist Dr. Yasmin Kazi. And I just came on first time, and the first experience I was so scared and tired about my situation. And one lady, she was in the reception, her name Fathiya. She is the receptionist. I talked about my situation and she told me she is the best doctor. Yes, Dr. Yasmin, she has 26 years and she have a lot of surgery every day.
I am a senior consultant gynecologist and advanced laparoscopic surgeon. I am the head of the department here at Bahrain Specialist Hospital at the area of laparoscopic gynecology and advanced lap surgery and hysteroscopy. I'm also a fertility specialist and I do IVF, and I'm a fellowship trained doctor, and basically I have trained in India as well as all over the world. You could say that I am a globetrotter. I am licensed to practice in UK, US, and I've been practicing in Muscat for the last 6 years prior to joining this hospital, where I was the topmost laparoscopic surgeon. And basically that's what describes my qualifications. I'm 26 years practicing.
The day when I was entering in Bahrain Specialist for the surgery, there is one doctor, he was so nice. He is the person in charge of anesthesia for my surgery. He's Dr. Fadi. This is the first day when I saw him. He relaxed me. He really relaxed me. And he said, Shahrazad, you will just sleep and you will wake up.
My message to everyone would be, first thing is that our outlook as doctors is not to detect fibroids in people. Our outlook is to see and to make sure that you're healthy, not only in terms of fibroids but for anything related to our area. So I would encourage everybody to go for a checkup.
I advise all the ladies to check minimum every 2 years. At least if they find something, they find solution on the spot. And I want to thank Dr. Yasmin. Thank you so much.
Every week at Health Hub, we bring you the latest and most relevant information to your health. I'm Dr. Khawla, and I'll see you next week. Stay safe.